to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're diving into a topic that can feel both scary and isolating: how to emotionally adjust when you or your family receives a genetic diagnosis or genetic information. We're honored to be joined by Mary Frances Garber, a genetic counselor with over 30 years of experience. She specializes in supportive genetic counseling, helping patients and families cope with the emotional side of genetic information. So thank you, Mary Frances, for joining us. Welcome to our podcast today. How are you doing?
Thank you so much, Dr. Borrelli. Thank you for the invitation to be here. And I'm very much looking forward to the conversation that we're going to have.
Oh, I'm so happy to have you. Well, so many people have heard of, genetic counseling, but they might not really understand what supportive genetic counseling really means. Can you maybe explain a little bit of how your approach is different?
Absolutely. I came up with the term supportive genetic counseling just to differentiate what I was going to try to do at this point in my career. And in a nutshell, this supportive genetic counseling that I'm doing really focuses on the emotional response that patients or families have to the genetic information they've been given. I hope to complement what the genetic counselors are doing in the medical centers. I started wondering what happens to our patients when they drive out of the parking garage. Like, who do they talk
Sure.
to about the information they've been given? And who helps them navigate that emotional journey? And so I like to think of it as, I sort of pick up where my colleagues leave off and help the family members, when they get home, be a cheerleader for them, an advocate for them, and a counselor.
Oh, that's amazing. It sounds so interesting and definitely well needed. So that's such an important distinction. Many of our listeners may have experienced the shock of a diagnosis during pregnancy for a child or even for themselves. What are some common emotional responses that people have, and how do you help them through that? I know that's kind of a big question, so whatever, respond in however you said.
Yeah, I guess I would break it down a little bit. I think whenever we give our patients a diagnosis, whether it be a true genetic diagnosis, chromosomal diagnosis, or even just, birth defects, I think there is immediate shock and disbelief. And patients or parents experience grief and all of its stages. With genetics, people experience guilt, even though most of the time these birth defects or genetic variations are random. You can't cause it, you can't prevent it. People still wear guilt. And, how do I help people manage this shock, grief, denial, anxiety, and guilt? I think, first of all, it's really allowing them to feel all of it and to talk about it, not to try to run away from it, and to normalize what they're going through. Like you said, I've been doing this for over 30 years, and most of my career was in high risk obstetrics. But now, I have this experience in pediatrics and adults too. And there are patterns that you see. There are patterns that I see with my patients and their partners, and you can just sort of normalize it and say, oh, yes, other people feel this way too. I've run support groups, and then they can also see through peer expression that they are not alone.
Wow, that's amazing. So I imagine the decision-making process can also be incredibly stressful, especially when it comes to prenatal testing or hereditary cancer risks. How do you support people in making these tough decisions?
Yeah, I think, in prenatal, I think prenatal diagnosis is one of the hardest experiences that any patient or couple will have to navigate. Everyone celebrates pregnancy. They get going. If the pregnancy is successful, they're going along. And then there's this before and after event with prenatal diagnosis. People all of a sudden are at a fork in a road. They were going along and now they're at this fork, and they don't even want to go down to the left or the right. They want to go back. They want to go back to before their blood was drawn. They want to go back to before the ultrasound technician called the doctor into the room. They want to go back to before they had a demise, and so they're at this fork in the road. They're having to make some decisions on how to get to the next step. And I sit with them and encourage them to envision going down one road and then the other. Is this the right decision for them if they're going to make a difficult decision and not continue the pregnancy? Is it the right decision to parent a child? What are those needs? Who is going to be there for them? Are they a single parent? All of these different things I explore with the patient or the couple, helping them navigate the decision. And I give them resources, discuss outcomes, and I'm a witness to their journey. At the hospital, we used to meet with people maybe once or twice, but here I have the luxury of meeting with people many, many times throughout the pregnancy or after the pregnancy if it's not continued, to help them navigate that decision.
Wow, I can only imagine how helpful that would be for them, for sure. That's amazing that they have you to support them. So you've worked in both high-risk obstetrics and hereditary cancer counseling. Can you share an example of how supportive counseling has helped a patient or family cope with their situation?
Mm-hmm. Okay, so I guess I would maybe talk a little bit about, when I started out in this field, we didn't have that early blood test and we didn't have the early ultrasounds that were being done as screening tests. I'm talking about between 10 and 13 weeks. Everybody was waiting in the 80s to have an amniocentesis at 16
Right.
weeks.
Exactly. Yes.
So there was this blissful period up until then. And now what I'm trying to help my patients with is this longer period of anxiety. So in high risk OB, let's say, I would have a patient who had some screening in the first trimester and they were flagged that the pregnancy is at an increased risk for maybe Down syndrome or a different chromosomal condition, but they're going to have to wait now until the 16 weeks to have an amniocentesis because that's the diagnostic test they're choosing. And so between weeks 11 and 16, there's heightened anxiety and people can't sleep and they don't want to tell anybody about their pregnancy. And so they meet with me to go over all of this and I help them navigate that. And then you have the test at 16 weeks, and it takes a little while for the results. And again, that high anxiety period. And then you finally get your confirmatory testing. And if the pregnancy does have Down syndrome, let's say, I have helped many, many, many people, hundreds of couples, navigate that decision, like I talked about before. And if they don't continue the pregnancy, I support them through that and the healing and the grieving and the trying again. If they continue the pregnancy, I work closely with the Massachusetts Down Syndrome Congress and would invite that family to talk to other parents, to be a part of the support groups that I run for new and expectant couples, etc. So it's really just, being a witness to that experience and helping support them so they really don't feel alone and isolated.
That's amazing. Yeah, that's great.
If you want me to talk a little bit about a hereditary cancer scenario, I would think about a woman who was referred because she was BRCA positive. She has a variant in a hereditary breast and ovarian cancer gene. And she's finding this out after her sister had breast cancer and found this out. And so now she's positive too. And right away, she goes into this stage of grief over her sister and her diagnosis, grief thinking about that's going to be my same course, and having to help her adjust to her new pre-Viver status, and at the same time help her make decisions as to when does she want to have surgeries, when is she going to have her screening, and then all of a sudden she realizes, wait a minute, each of my children has a 50% chance of inheriting this from me. I have a son and a daughter. How are they going to deal with that? Who's going to marry them? And all of these questions come flooding to our patients, but you help them realize, wait a minute, you don't have to tackle all of that today. You are going to first think about your health and the decisions you have to make, and we'll talk about the children, your adult children, on a different day, and just helping people slow down and realize you're going to be okay.
Yeah, that's a great point. I think slowing down and reminding people to take it like one step at a time is huge because, I've experienced issues personally or with families, aside from professionally, where you kind of, it's good to have that reminder because everything is just happening so fast. It almost seems like a big whirlwind of everything going on.
Exactly. And they feel so overwhelmed, and
Yeah,
you just really want to. Now, you can't say to somebody, slow down,
right.
but through other words, we're going to tackle this today. And how about we look at that in a couple of weeks, that kind of thing.
Yeah, no, for sure. Yeah, I get it. That's a good. It's almost like I feel like if you just tell someone slow down, it's almost like telling a woman to relax or, or
Exactly.
something. Nobody
That's
wants to
exactly
hear
right.
that,
That's exactly right. And none of us want to be told to relax.
right? Exactly. So yes, I think of that. For our listeners who may be going through something similar right now, whether it's adjusting to a genetic diagnosis, grieving, or just feeling overwhelmed, what's the most important piece of advice that you'd want to share with them?
I guess I would share that you're not alone. There's always somebody to be by your side, whether it's a trained provider with a service like I'm offering, whether it's a family member, whether it's a peer who's also in that same situation, and there most people can find somebody else either through their doctor or through their genetic counselor. So you're not alone. And, I've seen so much like tragedy, loss, recurrence, grief. But I guess the other thing I do say and I would say is you're going to be okay. You're going to be okay. You're going to get through this decision, or you're going to get through this testing, or you're going to get through this loss, and you're going to be okay. It's going to take time, but tomorrow, whenever tomorrow is, will be a brighter day, and this will become a chapter in your life journey.
That's so true. I think that's very well said. I'm sure our listeners would love to know more about you and are really curious about how they can connect with you. So, where can people find more information about you and the work that you're doing?
Oh, that's very nice. Well, I would tell people they can find me. My website is www.listeningreflectinghealing.com. You can just Google Mary Frances Garber, and there will be a variety of things that come up. But my email, mfgcgc@yahoo.com. If people prefer phone, 7813665300. I check it all the time. I will call people back. I will email people back within a day. And sometimes it takes a little bit of courage to make the first phone call or send the first email, and that's okay. If you can't do it today, maybe you can do it tomorrow. Um, and I am limited in terms of who I can counsel given licensure, but you can always reach out, and we can see if you're in a state where I can counsel. The counseling is related to where the patient is sitting, and I'm licensed in Massachusetts and New Hampshire and Florida, and then of course the states that don't have licensure at this point, and there still are quite a few.
That's wonderful. Well, thank you so much, Mary Frances, for joining us today and for sharing your wisdom. Your work is such an important reminder that genetic counseling isn't just about science. It's about humanity, empathy, and healing. I really hope this conversation has helped our listeners feel more confident as they navigate their healthcare journey. Thanks so much and have a great day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.